Today we're going to talk about deep learning in the medical world, and more specific about multimodal fusion. Hello, my name is Emiliya, and when I was a little girl, I wanted to be a doctor, but I grew up to be a data scientist. In this talk, I will show you how I found a way to contribute to the medical field as a data scientist. So, let's start. Today we're going to talk about different data types, different modalities, what is multimodal fusion and why it is needed, different architectures of multimodal fusion, early, late, and joint, and their properties and benefits. In the machine learning world, we have different data types and different methods to analyze them. Sound in medical context can be a heartbeat of a patient, for example, and can be analyzed with time series algorithms. Text data can be a doctor notes or patient clinical history and can be analyzed with NLP tools. Image data can be a MRI, CT, or ultrasound scan and can be analyzed with image processing algorithms. To each data type, we will address as different modality. After getting familiar with different data types, different modalities, and different methods to analyze each modality, we are going to talk about different architectures of multimodal fusion. But before we dive in, let's understand what is modal fusion and why we need it. Multimodal fusion is the process of integration of information from various input modalities and to combine them in the decision-making process. Let's take, for example, this scenario. We want to predict survival time for brain tumor patient. We have MRI scan and patient information that include age, gender, tumor size, and histological type. In our prediction process, we will combine these two modalities to get the most accurate prediction. If we train one model, only the MRI scan as an input data, we get 81% accuracy to predict survival time for brain tumor patient. If we train another model, but now only on the textual patient information as an input data, we get 63% accuracy. So if we need to choose, we will choose the MRI model. But what if we will try to combine the MRI and patient notes? What will be the accuracy then? If we train a model on MRI scan and patient information, we get 90% accuracy. And this is a real-world example. Here we can see a research published by Nature magazine that have been done in the field of combining different modalities to increase accuracy rate. This emphasizes why we can benefit from multimodal fusion. And now let's talk about different fusion architectures. The first one, early fusion, commonly known as data level fusion or feature level fusion, refers to the process of joining multiple input modalities into a single feature vector. The input of the modalities can be raw data or structured feature. The data fusion can be fused by concatenation, pooling, or graded units and become the input to the machine learning model. Early fusion architecture easy to implement is just concatenation of the feature or the raw data. This architecture exploits dependency between features. The second architecture is a late fusion or decision-level fusion. Late fusion refers to the process of leveraging prediction from multiple models to make the final decision, which is why it's often known as a decision-level fusion. As we can see here, we have different models that train on different modalities, and only the prediction of the models are fused in the decision fusion stage. Decision fusion mechanism can be averaging, majority voting, weighted sum, or even machine learning approach. The choice of the fusion mechanism is usually empirical, and it varies depending on the application and the input modalities. This approach is simple to implement if the input modality uncorrelated or have different sample rate or dimension, because each model trained on the specific input modality. Joint fusion is the process of joint learned feature representation from intermediate layer of neural network with features from other layers. As we can see in layer 2, we have joint representation of feature from modality 1 and modality 2. Features are learned using different kinds of layers. The feature representation are fused using fusion layer, also known as shared representation layer. This shared representation layer can be single shared layer that fuses multiple channels at some depth, or could be gradually fused one or more modalities at a time. Better feature representation can be learned during propagation process. Although learning a multimodal representation using the shared representation layer is indeed flexible, many current architectures require carefully design in terms of how and when. This choice of choosing various representations at different depths is perhaps the most powerful and flexible aspect of deep multimodal fusion, as opposite to other fusion techniques. Properties and benefits of different fusion strategies. So, let's see which of the statements are true or false. Able to model interaction between features from different modalities. This is true in early and joint architecture. In these architectures, we fused features from different modalities, so there is interaction between modalities. Learning more compatible features from each modality. It's true only in the joint architecture. In this architecture, feature representations are learned during the propagation process. Does not necessarily require large amount of training data. True only in late architecture. We can choose the best model in case of shortage of data. Required training multiple models. True only in the late architecture. Prediction of the models are fused, so necessary more than one model needed to be produce a prediction. Flexibility to join input at different levels of abstraction. True, only in the joint architecture there is a choice of fusing various features, representation, and different depths. In this talk, we talk about different modalities in the medical world, medical image data, such as MRI, ultrasound scan, medical textual data, such as doctor notes about the patient or records of patient history. We talk about multimodal fusion, process of integration information from various input modalities and combine them into the decision-making process. We saw the combination of more than one modality have the potential to increase the model prediction. We learn about different architecture of multimodal fusion, early, late, and joint. And we talk about their properties and benefits. This is a brief introduction for this fascinating field. I hope this talk made you want to explore this subject furthermore. Thank you for your time, and feel free to contact me if you are also fascinated about the future of medicine in the machine learning world. Thank you.